Welcome to Lyme Time. I'm Allie from the Tick Chicks. We are all more than Lyme disease and chronic illness, and together we stand with you to overcome and rise. I'll bring you closer to the experts in cutting-edge treatments and even a few unexpected ways of healing. I'll ask the questions you want answers to regarding Lyme disease and successful ways of getting you closer to 100%. We are in this together and will not be defined by Lyme. Today on Lyme Time, I am thrilled and honored and beside myself, quite frankly, to welcome Amanda Fairbanks. Amanda is an award-winning journalist and author of The Lost Boys of Montauk, The True Story of the Wind Blown, Four Men Who Vanished at Sea, and the Survivors They Left Behind. Her writing has appeared in the New York Times, the Boston Globe, the Atlantic, the San Francisco Chronicle, the Columbia Journalism Review, Airmail, and the East Hampton Star. A graduate of Smith College and a former Teach for AmeriCorps member, she has 2 master's degrees from Columbia University's Graduate School of Journalism. She is currently in the beginning stages of researching and writing her second nonfiction book about Lyme disease. The California native lives with her family in Sag Harbor. Welcome to Lyme Time, Amanda.
Oh, thank you so much for having me. It is such a pleasure. I've been looking forward to this conversation for many weeks now. Thank you for making the time.
I love that you're a California native too, because, I'm in California, and as you know, I went undiagnosed and misdiagnosed for many, many years simply because I lived in California and nobody had bothered to ask where I had vacationed the last 2 summers. So,
Remind me
I'm
again,
sure
what
you
part of
can relate.
California are you in?
I'm sorry,
What part of California are you in?
I'm in Los Angeles.
Okay, yeah, right.
So, that's a whole other podcast though. But
Yes.
we have a lot of things to cover and a lot of newsworthy and timely events. They say that everything happens for a reason, and I think we had to reschedule this interview, and that was actually just perfect for what we want to talk about today, which is largely about the insurance with Lyme disease and some of the obstacles that everybody faces. But let's start first with your interest and experience with Lyme disease in particular. Can you tell us a little bit about your personal journey with Lyme disease? It's one of the more difficult journeys that I had to read about, but at the same time, so relatable to so many.
Yes. So thank you. I'll try and condense it as much as I can. So I am now in year 5 of my first diagnosis, and I had in the fall of 2018, we had just moved back. We were on the West Coast for 2 years, and we moved back to Sag Harbor, which is in the sort of eastern tip of Long Island, a hugely endemic area for Lyme disease, although I didn't know it at the time. We went to a party for my daughter's new nursery school. We were standing outside on these beautiful bluffs. I was wearing sandals and a dress. And the next morning I looked down and I woke up and I had this just very bizarre looking red, angry, strange looking rash that I'd never seen before on my body. And we didn't really have a doctor. So I just sort of went to our local urgent care and said, what is this? We're in like the middle of unpacking boxes, and it was like a period of a lot of chaos. I had 2 really little kids at the time. And she asked me, have you been swimming in the bay this summer? Or we sort of separated between the Atlantic Ocean on one side and the Long Island Sound on the other. And I said that I had, and she said, we're seeing some of these cases where there's like a bacterial infection in the water as the temperatures rise. And I think you should just put some ointment on it, and it's, it'll go away and it'll be fine. And so I did that. I filled the prescription, I put the ointment on, the rash went away. I went about my life not knowing that I should have absolutely demanded at that moment for at least 21 days of doxycycline, right? Because it's likely that I've been, but I never saw the tick. I never pulled a tick off my body. I just saw the rash that it had left behind. And so about a month or 2 after that, and this I wouldn't connect these dots until, kind of my diagnosis about 9 months later. So about 6 to 8 weeks after that rash, I had sort of partial facial paralysis. That went away. Then I started diving into the writing of my first book. And I'm a longtime journalist. I've written tons and tons of magazine and newspaper stories. I'd never written a book before, and this was a heavy lift. It was a heavy lift in terms of both the content. It's a lot about grief and loss and survivors and the women left behind. And I conducted, interviews over the course of a few years, hundreds of people, hundreds of thousands of interview notes type of thing. I read just anything I could get my hands on to understand more about the sea in this part of the world. And I write narrative nonfiction. So everything I write is true, and it's based on all true facts. So I spent that winter writing that book and handing in the first draft to my editor. And by the time April of May of 2019 rolled around, I kind of just, things were not right. I was misplacing my car keys, and I was getting lost when I was driving familiar roads, and I was just incredibly forgetful, which is unlike me. And I also entered into really the most sort of, well, now that I've gone through it a few times, not the most, but like a very, very sudden onset of like an extremely anxious, like unrelenting depression. And it just sort of came out of nowhere. And there wasn't like a precipitating force. There wasn't like a traumatic thing that had happened in my life. It was just like I went to bed feeling one way, and I woke up the next morning feeling terrible. I had a little bit of postpartum depression with my daughter. I was briefly on an antidepressant for that. But then I went off of that, and I hadn't really ever experienced those feelings before. And this was like on a whole nother degree of magnitude. So I started going to doctors. I went to a local internist. I went to a rheumatologist. I went to see my gynecologist, thinking, could this be hormonal? I was 39 at the time. And everyone just sort of kept saying, they would run blood work. All of my blood work was normal. No one thought to run a tick panel, given my list of symptoms. And it wasn't until I came into the city and I met with this really brilliant functional psychiatrist. Her
Hmm.
name is Dr. Catherine Falk, brilliant woman. And she works out of her home on the Upper East Side, and I went into her home, and uh, she just, you just know when you're in the presence of kind of true wisdom, right? So she takes a look at me. She kind of flips through the lab work I had provided her, and she's like, "Where do you live again?" And I said, we're way out in Sag Harbor." And she's like, "Amanda, I don't think you need to be treated for depression or anxiety. I think you have Lyme disease."
Oh my gosh. What a
And
gift.
I said, what are you talking about? Lyme disease. She's like, "Well, we should just test for it. I mean, I do a lot of blood work as part of my initial assessment. And so let's just we'll send these labs out and we'll see what comes back." And we didn't even do IGeneX then. We did like a ton of work with MDL and then whatever my insurance would cover. And maybe about a week later, I get an email from her. I hadn't heard from her since. And in the subject line, it just says CDC positive Lyme. And she attaches the MDL report. And I have 6 bands that are positive for not IgM, which shows recent exposure, recent infection, but IgG, 6 IgG bands. So plain as day. And I really feel fortunate because I know that for so many years, not only are people, especially women, disbelieved with their symptoms, but so often the lab work that exists doesn't give us that elusive diagnosis that we're going in search of, right? And that's a huge piece of it. So I'm very grateful for that, right? Like I knew what we were treating. So then I had to go in search of something called a Lyme literate doctor, which I didn't know existed. And of course, none of them take insurance, which I also didn't know was another, like I had never seen an out-of-network provider before. That had just never been part of my world. I had been healthy up until that point. So anyway, I really kind of crossed over unknowingly into just an entire world of chronic illness, really, that I didn't know existed. I knew that it existed from from an observer's point of view, but I certainly had no personal experience of living in that world myself. So that June, I was fortunate to get an appointment with a physician who actually recently passed away. And his name was Dr. Benjamin Asher. And he had gone to Harvard Medical School and was a former ear, nose, and throat surgeon, and just a brilliant, brilliant guy. Such empathy, such a great listener. Really the best doctor I think I've ever seen in terms of just like sitting down with someone, taking their history, and really feeling like a true degree of empathy, such genuine compassion. And he didn't just treat Lyme disease, he treated all sorts of things, a lot of opera singers with their voices, and that wasn't his only specialty. But he said, given your symptoms, and obviously you have this, you have Lyme disease. He again confirmed what it was that I had. My mother was sitting in the corner of the room, terrified, wondering what we were doing. She felt like he was like divinely inspired, like he just had this like very magical kind of quality. He would sort of pause and think and kind of look down and like come up with a treatment plan. So the long and the short of it is that I didn't go on anything remarkable. I took a lot of doxycycline for that whole summer. So because I had had this infection raging in my system for almost a whole calendar year, I started on 200 milligrams of doxycycline twice a day. And by July, I had to drive around with these ridiculous gloves on my hands because the sunlight through the windshield, I would like get a blistering sunburn. I truly felt allergic to the sun that whole summer. And I was very sick. But progressively, as that summer went along and into August, and by early September is when the needle really shifted for me. I went off the doxycycline, and for about the next we started then kind of attacking my gut health and all the damage all of those antibiotics had wrought. And it wasn't really until the fall of 2022. So I edited my book. My book came out. It did really well. I did like, I don't know, 60 or 70 different talks. And I felt like this was something I had dealt with and was in the past, right? That I wasn't slotted into the kind of the chronic Lyme category that I so feared. I've spent a lot of time on Reddit and Googling symptoms and communities. And I felt so fortunate, like, oh, okay, I don't have chronic Lyme. I've treated it. It's something that I'm no longer, my immune system is no longer dealing with. And it was in the fall of 22 that again, I've always had neck up symptoms. I've never had joint pain. My knees have never swollen up like balloons. My symptoms are all neurological in origin. So it gets really confusing, I think for a lot of doctors, for psychiatrists, for neurologists that I've seen, to really know what's going on. And that next January, I was in just a very, very dark place. I tried ketamine therapy. I thought I was treating a mood disorder at first. It honestly just didn't occur to me that it could even be Lyme disease, right? Or a relapse of Lyme disease. I hadn't gotten another tick bite. I didn't have another rash. My lab work wasn't coming back with all of those bands type of thing. Although I still showed exposure to some of them. I think we always have antibodies to some of them. The opinions are mixed. So anyway, I did ketamine therapy. That didn't work. I kind of tried, I radically rehauled my diet, started exercising more, all the things that make you feel better. And the needle just wasn't budging. And I reached out again to Dr. Asher, and I got an away message saying that he was on a medical leave. And he had given a whole list of different specialists to see, so that you kind of wouldn't have to like continue bothering him for, for names of people. And he suggested that I see a doctor by the name of Leo Galland, who really kind of pioneered functional medicine. He's now in his 80s. Strangely, although he's been my doctor for the last 2 years, I've never met him in person because he only practices on Zoom. He does online medicine. But our first assessment in January of 23, sorry, we're in 24 now, January 23, was really the most thorough medical assessment. It was like from birth until present. And he went through like all the antibiotics I took as a child of the 80s and, all the things I had done with Dr. Asher. And it was really remarkable because he would be able to discern through the computer screen, like these minute changes as I went through treatment. And so that spring, I also went and got an MRI of my brain, which showed, an abnormal amount of volume loss for someone my age.
Mm.
It showed these strange kind of white matter hyperintensities that I shouldn't have for someone my age.
Did
And
you have
I,
any lesions at all?
not lesions, but just like basically the MRI report said that this patient suffers from like chronic headaches, which I don't.
Mm.
Um, I'm not a headache type person. And so, and the neurologist that I subsequently went to see, who did a lot of tick-borne illness and was covered by my insurance, she said, "Why didn't you do IV antibiotics the first time?" And I said, "Well, I didn't really have that choice. It wasn't like I had a whole litany of choices of how to treat it."
Okay.
Um, and she's like, "Well, I did a spinal tap, which was a whole nightmare, which I'll spare you from. That showed like some abnormalities. It picked up on a Miyamoto strain, which is another type of bacteria. But again, it wasn't definitive. And so between Dr. Galland and this doctor at Stony Brook University, which is much closer to where we are at a hospital there, they both agreed that I needed to do a minimum of a month of IV ceftriaxone. So I went to the hospital and I had a PICC line inserted into the upper right arm. And I did a month of it, and I would have done 10 years of it had my GI system allowed it. I'd say by about the third week, I felt just a tremendous clearing of my brain. My
Mm.
mood suddenly improved. I was able to read books again. I wasn't anxious. It was truly transformative. And but meanwhile, I also am dealing with ulcerative colitis that had been diagnosed about 2 years prior. Again, I think because of all the antibiotic exposure. I don't have autoimmune disease in my family. But that degree, the ceftriaxone that I was giving myself every day, it was I think it was 2 grams. It was in like this little tiny, like a ball that would collapse, and these home nurses would come and change my bandages. But by the end of it, I was going to the bathroom like 15 to 20 times a day.
Mm.
And they both agreed that they both wanted me to stay on it for a bit longer, but my body just was not having it. So I went off of it, and I then sort of had to go back into my GI world and find a much better gastroenterologist. And thankfully, that part of my health is doing really well. But I'm on a biologic, which I wish I weren't, which is an immune suppressive drug. And hopefully, once my chronic Lyme stuff is under better control, we can explore some different options with that. But even Dr. Galland, who, does a lot of straight, holistic herbal therapies for his patients, agrees that for now, like, let's just deal with one thing at a time.
Uh-huh.
And I have since I called him sort of last Christmas and read him that same list of symptoms. And he went back to his notes from the January prior and read them back to me. And it turns out I was in another relapse. And so he put me in touch with a doctor much closer to us who practices at the Morrison Center. And he felt like he needed a doctor that could kind of like literally keep his hands and ears and like be able to see me in person and
Mm.
feel my stomach and take my pulse and all these sorts of things and be treated in person. There's Zoom medicine is great. And it's also really wonderful to sit in a room with someone and have them view you as a patient and treat you as such. And so he put me in touch with his name is Gerald Simons. He goes by Jerry, and he's been in the tick world since for kind of the last 40 years. It's really his subspecialty. He's a total character. He's filled with endless amounts of enthusiasm and exclamation marks in in our various text messages back and forth. And he has had a lot of success in treating his patients, which is part of the essay I wrote about for Oprah Daily, with something called Orbactive. And it's the off-label use of an IV drug used to treat like a MRSA and a staph infection. So really serious skin infection. Each dose costs $4,000.
Mm.
And part of my essay was the difficulty I had around getting them to finally approve it. And just the hours and hours and hours I spent on the phone with the various United Healthcare representatives getting them to finally approve it. But going back to the Herbactive. So Jerry has these kind of two categories of patients. First of all, not everyone is on Herbactive. I had the craziest Herx reaction the first dose. And then my subsequent two doses, I started feeling better and better. He has his like 3 and done. And then he has what he calls his Herbactive frequent flyers, which are the people for whom they'll have a flare maybe once or twice a year. They come in, they do this 3 to 6 hour infusion, and they feel a lot better. And then they have, and then he has patients doing all number of different things. So the most challenging 2 years of my life on a health front. So in June, we had moved back into our house, and my second book that I had been working on was suddenly canceled, and I started having another relapse. And I did another dose of Herbactive, the needle didn't move. I did more Rocephin, the needle didn't move. And in August, this is actually not in the essay, I went in to see a doctor in the city. She used to practice with Brian Fallon at Columbia's Lyme Clinic, and she's now in private practice. She mostly, I think, treats kids with pandas. And she's like, I'm almost 100% sure you have Bartonella going on. And that had never come back positive for me on a test. So again, MDL labs, I don't know what it is with me and MDL labs. My Agenix test, my FISH test it did not show up on the blood smear for Bartonella, but the MDL panel came back and among her patients and like the top 5% of the titers, but it had never shown up in previous blood work. Jerry's and Leo's view of that is that they had kind of gone after these kind of deepest, darkest cysts and biofilms that had allowed my immune system to kind of even begin to contend with this Bartonella that had been there all along. Bartonella often, as I don't need to tell you, manifests in a lot of psychiatric symptoms, a lot of depression, a lot of anxiety, a lot of personality changes. In kids that have it, they can have tics. I never experienced that. But so anyway, so I went on rifampin and minocycline, and then like a whole host of different supplements. And my body just could not tolerate the Rocephin. It's used to treat tuberculosis. I suddenly looked like I was 5 months pregnant. I was in just an extreme amount of discomfort. And I tried to stay on it as long as I could. And I've been on some heavy duty stuff, and I simply couldn't tolerate it. So we toggled off of that. We toggled off of basically everything because Jerry had me on a whole bunch of different things. And scientifically, it was just hard to know what was and wasn't moving the needle. Sometimes you're on this litany of supplements and it's like, what's helping, what's hurting,
What's the ingredient in the cocktail for sure?
Exactly, right. Like I'm taking these 20 things that have gotten added on as we go through time, and I'm re-upping on them, but are they still working? Right. So I kind of did like this wash out of my system, stopped everything, felt pretty shitty. And then in the last few weeks, I've gone on something called methylene blue.
Yep.
Which really started to move the needle for me in terms of my cognition. And I'm back on, and this is just going to be for a very limited amount of time due to, C. diff and the fact that I've already taken so many antibiotics. But I am back on Rocephin just sporadically.
Okay.
So, and then I'm also on just a ton, all day long. I'm then alternating that with gut health and trying to rebuild my poor immune system.
Absolutely. And like I said before, so many out there listening to this can relate. I mean, if you're going to strengthen one area of your body, inevitably another one gets damaged. And it's sort of like this whack-a-mole of drugs. And it's that in and of itself is depressing. I never struggled with depression before, but going through my own journey, I was really struggling at times. And I knew in my heart it wasn't depression. It wasn't like a clinical case of depression, but it was depressing.
Hmm.
And I could see how if anybody had a history with that, you would just go ahead and start treating, that first. And, it's just a whack-a-mole game, and it's extremely frustrating and sad.
Hi, I'm Dr. Bill Rawls. I've been exactly where you are now. I know what it's like to have your life disrupted by chronic illness. That's why I developed the Restore Kit to offer an effective natural solution for people struggling with chronic Lyme and similar conditions. To find out more about the Restore Kit and its benefits, go to vitalplan.com.
I'm going to jump around a little bit because I am interested, and I think a lot of people are very interested in, while you're going through all of this, and you mentioned one of your medications was 4,000 a dose. I am very curious about, you were basically going through back and forth in a torturous manner with United Health Group for years, who owns United Healthcare. And we're
Yes.
hearing a lot about that company in particular right now in the national news with its disproportionate denials
Yeah.
um, to
Highest, higher industry.
insurance companies. And it could be a while before Lyme patients are given the attention that they need, but talk us through some of the things that you weren't expecting from your own insurance company through Lyme disease.
So yes. So first of all, let me just tell you one story because it directly relates because it's so insidious. So I went recently for kind of like a second opinion from a supposedly great neurologist here in the city at Lenox Hill Hospital, and he couldn't have been more dismissive of my case. And I brought in my, abnormal MRIs and my giant stack of lab work. And I was there with my husband. My husband's a tenured professor at Columbia. We have great health insurance. I'm well educated. My husband's well educated. And it had been a long time since I had sat in a room with a doctor and been totally gaslit and disbelieved. And he said, I don't know whatever you had going on, but clearly it's been treated. And what I really think you need is just a little more iron. Your ferritin levels are a little low. And and by the way, I think you should enroll in our CBT program. I think your sleep could use some help. And he literally had like a flyer, like, and handed it to me. And he actually walked out of the room, and then he walked back into the room and was like, "Oh, I actually need to give you a physical exam." And he's like, "Well, you don't have Parkinson's, and you don't have ALS, and you don't have, any of the neurodegenerative disorders. And I don't know why it is that your brain works better when you take this IV Recefen, but it certainly has nothing to do with Lyme disease." So again, he falls squarely in the infectious disease camp. He does not believe in the existence of chronic Lyme. Um, Unfortunately, Dr. Galland had worked with another doctor in that same practice who had a much more nuanced view. Like, we just have to be very careful about who we expose ourselves to, right? But it'd been a long time. And I was thinking the whole appointment, like if my husband had been sitting there and
Ah,
I had been accompanying him there and he were speaking to this other man, would he be speaking to him in this way, right? Like it's like this hysterical woman that's just like searching for a diagnosis. And it was interesting because he said, as he's walking out of the room, just a god awful, egomaniac and just a horrible bedside manner, not a listener whatsoever. Anyway, it was a terrible appointment. We've all gone through those if we've battled any type of chronic Lyme, until you find your people that actually treat you as a human being, really. Um, you know, I do believe doctors still take a Hippocratic oath, which is to do no harm. This is a very harmful appointment. And I walked out of there in tears, just feeling totally disbelieved. And he said, I don't have to be your neurologist, but, given this history, you should probably come and have a scan, every 6 to 12 months. And I don't, maybe you don't like me, maybe we didn't get along, but, we should keep an eye on your brain, basically. So it was like I was believed but disbelieved. Anyway, it was insidious. The same thing occurred with United Healthcare, and it was interesting because while I was in the middle of, so I sort of got like this wave of energy as I was beginning the Orbactive, And I didn't know that I was going to spend, upwards of a dozen hours a week on the phone with them. And, I'm a journalist. So New York happens to be a one-party consent state. And I would have these calls with them, and every person would tell me like a diametrically opposed reason why it was that they couldn't approve this medication, or why it was that I had submitted my, because I was seeing all of these out of network providers and I was providing documentation, and we were trying to get some type of reimbursal from these appointments. I'm talking tens of thousands of dollars of medical debt at this point. And we have this supposedly great coverage that every time we get off the call, they would ask, what would I like to be sent to an in-network provider, who of course, like this neurologist at Lenox Hill Hospital, doesn't believe in the existence of chronic Lyme. And every time I say no. But anyway, so I'm gearing up for this fight, and I started just recording them because, Ted or Sally or Sue or whoever the heck I was talking to, like one day it was like, oh, okay, send us this. We'd send them that. They didn't receive it. We'd fax it again. They didn't receive that fax. We had 3 denial letters for Abactive. The first dose I paid for myself. We paid for ourselves. And then I went about, and I was like, just determined. They had a patient savings program, which you qualified for if your family of 4 made $75,000 a year or less. And I said to the woman on the phone, I said, so just to be clear, if my family of 4 made $76,000 a year, we would be able to afford $12,000 of out of pocket just for this IV medication. That would be affordable. And she said, well, I know what you mean. It's, I'm paying off medical debt too. I just have it on a bunch of low interest credit cards. This is a United Healthcare representative. And so it was just this like game of whack-a-mole, like again, being gaslit, disbelieved, led to this person, led to that person. I had the documentation that I actually had a staph infection. I had the thing, that they were treating with this drug. So finally, they're like, well, now the problem is that this whole time you've been sending it to like the wrong part of United Healthcare, and you needed to be sending it to the pharmacy side. This is like 6 weeks into this whole odyssey. So I send it to the pharmacy, and this actually happens pretty quickly. And I hear back, and she's like, oh, Amanda, it's so, thank you for getting this to us. We'd love to fill this order. They were located on Long Island. She's like, but there happens to be a national or Bactiv shortage. And I said, well, that's so interesting because I just spoke with them yesterday about this patient savings program, and my doctor administers this medication literally all the time. So I was like, could you please hold? And I patched in my pharmacist, who's this wonderful man named Andrew out in Sag Harbor. Just such a phenomenal caretaker, and just a really wonderful pharmacist. And I said, hey, Andrew, I have whatever her name was, Annie from Optum RX on the phone, which is owned by United Healthcare. Is there an Abactive shortage? Like if I needed to get another dose tomorrow, could you get one for me? And he was like, yeah, of course, we just need the script. No, it's no problem. And I said, okay, thank you. And so within maybe the next, I don't know, 3 to 4 hours. Oh, no, I'm sorry. After that, I called the actual Urbactive company, which is owned by Melinta Therapeutics. And I had been, again, like if I wasn't on the phone with United Healthcare, I was on the phone with Melinta. And this was just like the thing I was going to die on, right? Like I would just like, they don't know who they're dealing with. And the whole time I'm thinking of these tens of thousands of Americans that are like, they don't have this time. They don't have the patience. They're told no, and then they have to assume this tremendous amount of medical debt for this medication or this treatment that they need, right? This isn't like I'm asking for cosmetic surgery or something that's, for my like a dermatological procedure that's like this is medically necessary. I have multiple doctors, writing notes, sending in medical notes. So anyway, I called Urbactive just as like my second point of, data. And I think Tiffany picked up the phone. They have far fewer employees there. And Tiffany and I had spoken several times. And I said, hey, Tiffany, I happen to have our OptumRx on the phone, and she's telling me the funniest thing, which is that suddenly there's a national shortage of your drug that costs $4,000 a dose. And she's like, "What are you talking about, Amanda? We don't have a national shortage. We were just discussing whether or not you qualified for our savings program." And I said, "Thank you, Tiffany, for your time." And I hung up the phone with Tiffany, and I was speaking again, with the United Healthcare representative. And I think I said something along the lines of, I know that we all need to have paychecks and decent paying jobs. But honestly, I don't know how it is that you clock out of your job and you go home at night and you're able to sleep, because what you're doing is really criminal. And I realized I'm talking to like the tiniest little cog in this labyrinthine company, the CEO of whom, as you had mentioned, before our call, the timing of it was just murdered coming out of this annual kind of investors conference in Midtown Manhattan, about 20 blocks from where I am right now. And that story is developing. But again, I'm not condoning that we murder the CEOs of these health companies. It's part of a huge, larger problem. But again, I get a call 3 hours later, and my medication is suddenly approved, and it's $0.
$0.
$0. Because I had maxed out on my in-network and out-of-network benefits, and I just went and they mailed it to me, and I had my next 2 doses covered. My next 3 doses were, I could be getting a daily or active dose if I needed it, and it would be $0.
And as you mentioned, you stayed on them. You took your stack of papers. You were on it. People
Yes.
don't have this kind of time. They also don't have that kind of money. They have to go to their 3rd job for the day.
Totally.
And they can't even function to barely get there.
Right.
And those are the people that, are just probably, I'm hoping that your words will reach out to them, because this is what we mean when we say you have to be your own advocate. It means not taking any bullshit and then holding people accountable. If you're going to give me a throwaway answer as to why I'm not getting this medication or I'm being denied, I'm going to get somebody else on the phone and let's talk to him and let's just have a conversation. It's maddening.
It is maddening. And the whole time I would think of, like as I'm listening to this hold music that I think is designed to just make you absolutely insane. Like I would just think of all these Americans sitting on hold all around the country. And United Healthcare, I think, is one of the largest health conglomerates in our country. It's very, very popular on the East Coast. I don't know what insurance you have. They do have the highest denial rate among all of the big insurance companies, in terms of their claims. They're very good at what they do, which is to not pay for the vital healthcare that their paying customers are in need of, because it means less money in their pocket. And I truly do believe it's criminal. And I felt this sort of sense of obligation, both to myself, certainly in terms of learning to advocate for myself, but also just like I'm in a very privileged position. Like I happen to have these skills. I've worked as an investigative journalist. Like I know how to like track information down and just like stay on top of people and not take no for an answer. And I got kind of aggressive about it. And like even like, but I'm still dealing with them. Like even yesterday, this is a funny story. So I call because I have to get, the year's about to run out, and I want to find out what our vision benefits are, because I want to just like, milk them for all they're worth, right? And I need to get glasses, whatever. So I call them, and it's like 1 million people I have to get transferred to, finally transferred to the vision. And every time you call, it's like, all of our options have changed, they've never changed. And at the end of this call, we'd like you to take a survey letting us know about, the efficacy of our call. And it's always on a scale of like 0 to 10. And every time the call ends and the robot is like, "I'd like you to rate this call," I'm always like, I always say 0, right? Always say 0. But I was having like particularly bad cell reception yesterday. I was like getting ready to come to the city. My husband's sitting downstairs, and the robot, this like robot who's taking my survey and logging it, is like, I couldn't understand what you said. So I'm like screaming into my phone. I was like, 0, 0. And then
Oh,
I hung up the phone. And my husband knew the whole time, like who I was to and what I was talking about. And there's something just like, I mean, again, I'm not even talking to like a human being, and they don't give a shit about my feedback. He's probably like, given what's happened in Midtown, like the FBI is probably already listening to your call. Like, what, I certainly got like a lot after that essay came out. Firstly, I heard from a lot of people suffering from chronic illness in their various fights with insurance companies. And we
sure.
are absolutely not alone in this battle, whether you have Lyme disease or any other type of chronic illness that isn't like very easily identifiable and tested and treated in a very kind of Western medical context. Anytime you start living outside that world, be it Lyme disease or lupus, or I mean, we could go on and on and on. If you don't have cancer and you have something else going on with your immune system or an autoimmune condition, like good luck with that, because the system is not built and engineered by design, I think. And it's not nuanced enough in order to really deal with that. And we're seeing this rise in all sorts of chronic illnesses, not just Lyme disease.
I want to talk a little bit about that.
Yeah.
In sort of at the same time you're dealing with all of this, capital ALL, all of this, you went on to write an incredible article for Oprah Daily, and it was titled "How to Save Your Life While Fighting Health Insurance Conglomerates," which featured 6 lessons you learned while you were investigating that article. Can we briefly just touch on each one, because I think this would resonate with a lot of people. And if you have not read this article, to any of my listeners out there, it's Oprah Daily. Just type in Amanda Fairbanks Lyme, and you'll get this article up on your Google search. And it is an incredible read for anybody out there. But let's just touch briefly, because I think this goes in line with what we were just talking about. Starting out with misdiagnosis is really a thing.
Right. Being disbelieved and being gaslit is a thing. It's part of the process.
People people that don't have Lyme disease and don't understand will often just immediately defer to the doctor's opinion and say, well, and so then again, you're being gaslit at home too, by saying, the doctor doesn't really know what it is, and kind of leaving yourself in this lurch for a while. Also, out of network really means out of pocket.
Yes, that was a whole new lesson that was just unknown to me. That some of this money would be reimbursed, but even though we were paying into this very high premium insurance package, once you start going out of network, you're really in the fight of your life. Yeah.
And not only out of network, but with any integrative or functional medicine doctor, I mean, I'm still submitting super bills for treatment.
Oh, the super bills and the ICD codes. I have nightmares about ICD codes. Okay. And they're always like, you didn't submit the first primary one. And then I submit that with the primary one. And I mean, I'm like, it's like, I mean, I work and do other stuff, but my other part-time job is like resubmitting super bills.
Yeah, it's a full-time job. And I have a stack of them on my desk right now, going back probably, I hope my husband isn't listening to this, but over a year, because I have this PTSD now with regard to the stack of super bills that I'm like, it's just I have this doctor fatigue, and now
you have to log in every time, and yeah, it's a maddening process. I hear you on the stack of super bills.
Another lesson you learned is, when you're adrift in a sea of despair, keep treading water.
Yes. Chronic illness will really show you very, very quickly who your people are. And, not that I had such a huge network of friends, but it's really distilled the people for whom I know I can rely upon. There's this great Maya Angelou quote that says something like, when people show you who they are, believe them the first time. And, the people that really stuck by my side, who texted and checked in, and not in an intrusive way, but in a caring way, were small in number and had all battled not Lyme disease necessarily, but other types of similar health or mood disorders. and just kept kind of encouraging me. I was having a lot of suicidal ideation at one point. I was, part of from the disbelief, from the lack of clear treatment, and all of those things take a toll on you. And I would, I had this friend that just kept saying, this too shall pass, and I thought it was a bunch of bullshit. But I'm learning how to try and live with, to keep treading water and eke out as much as I can during these periods when I feel well again, because I don't know, I feel not like I'm living on borrowed time exactly. But I do feel that I don't know when I will have another relapse and how far that will take me down and what that will look like. And I have PTSD from that for sure. And it's something that I will now need to work on. And it's been an issue with our family and our children. And, it's really affected all of us in different ways.
So I was there, I can tell you, and being afraid to live your life again because you're not sure if it's going to push you too far is a horrible, paralyzed state of being. And it's one of the last things that I had to do once I got my body under control. That is when I started in with the brain retraining, because my body's still stuck in fight or flight, right? Even though
Right.
even though the co-infections may have subsided, or my Lyme is now dormant, I'm stuck with this paralysis emotionally of, oh yeah, I'd love to, host a big birthday party for my children or something like that. I mean, it could be the littlest thing that you're trying to do for somebody else, or like take that first ski trip, or take your first trip on an airplane, and taking all the supplements and all of it just goes, and it's so many layers of trauma on top of the Lyme disease.
I relate to every single thing you just said. Yes.
Yeah.
Yes.
So
I'm also like, I used to just push it, right? I lived without limitations. And if I needed to work really hard, I would just gun it, and I would drink more coffee, and I would it just wasn't a thing that I was so concerned on, like setting limits. And I need to learn to go through the next phase of my life, doing the work that I love to do and taking care of my kids and doing all those things, but setting limits and realizing that I have to take really good care of myself.
yeah, I
Ways
talk a
that I
little
never
bit.
even thought about.
I feel as though there are so many people out there that are type A personalities that did exactly what you just did through chronic illness, and pushing it aside, or, okay, I'll deal with this next month, or I'll go to the doctor in 3 months, or, something like that. And it's just totally relatable to everyone. And then you touch on two other things: the medicine that can cure you, make you sicker before it makes you better. And when your life is on the line, refuse to take no for an answer, which I think is the underlying theme here.
Yeah. I mean, it's true at your sickest, and it really shouldn't be the case, right? You're sickest, you're weakest, you're most vulnerable.
Yeah.
In our country right now, you're really being asked to take on this Herculean effort to, to stand up for yourself, to take no for an answer, like all these things that take so much energy away from your healing.
So many.
And this precious time, right? That rather than talking to the United Healthcare representatives, I could be doing all sorts of other things. And
So
yes,
for the
obviously, I talk about United Healthcare because this is my insurer. They are obviously, hardly alone in all of these things, and all of these major healthcare conglomerates operate the same. I think we just have to figure out a better way of going, forward, and how the industry might get reformed, and who knows.
Was there anything in particular, a couple of tips that you might be able to let our listeners know that helped you keep organized or prepared? You're saying that this is potentially a criminal in nature with these insurance companies. So let's just say in 5 years that we might actually be heard and our stories might be heard. Is there any sort of thing that patients can do to help offset anything, or tricks to help them, sort of keep organized or navigate the healthcare insurance web?
I think you have to start taking really good notes, like by the date. This is the person I spoke with. This is literally what they said. You can record them if that's easier. You can use like a little voice memo on your phone, which I did a lot, or on your computer. I think you have to start taking really good notes because, of course, you speak to 5 people in a week and you'll not remember who it was that you spoke with. They'll never give you their last name because it's their, as with the former CEO of United Healthcare, everyone's worried about finding out their identities. But I do think it's really important to document who you're speaking with, to document what they told you, because what will happen is you will speak to another person the next day or the day after that, and they will literally tell you a diametrically opposed thing. And while you're going through treatment, it'll make you feel crazy because you'll think, wait a second, that's not what so-and-so said to me 2 days ago. But if you haven't written it down, and I made that mistake early on, was just sort of calling randomly or calling from the car, or calling in between different things.
Right.
I think it's really important to take careful notes. That literally, and I think it's like, imagine, I think you almost have to imagine, we take, especially as mothers, we take better care of our children than ourselves, right? That just comes naturally. I think you almost have to, in these moments when you're in this type of battle, imagine that you're caring for the most dear and the most vulnerable person in your life. And what kind of energy would you expend to make sure that that person received the best care possible? And that person is you. But that takes a lot of work and a lot of time and effort and energy. That's really a waste of our time.
I think that's a good analogy. Everybody can relate to the mama bear or the daddy bear energy when don't mess with my kid. And you
Yeah.
really have to conjure that up when you're talking about yourself. And it's like, don't mess with me here. I know what I'm talking about, and this is not what was covered in the last conversation. So it's like really holding those people accountable. If they can answer your question, get somebody on the phone that can.
And I did. There are a few times I wanted to give up, and I kept thinking, like, God, if this were about Theo or Violet, my children, I would be in, like I would, if they thought they were dealing with the difficult Amanda this time, like this would be on me on steroids. Like if they weren't covering something for my kid, like, they would really truly have hell to pay. So I do think you have to kind of, take on, and again, that's part of feeling your sense of worthiness and your sense, it's like all of these things are working against you to feel like you're crazy, like this is all in your head. You've been gaslit, you've been, tortured by this like Western medical system that doesn't want to identify you. And, this illness that if we were to sit down and we had 20 practitioners on this Zoom call, they would have 20 different ways to treat, what you've gone through, what I've gone through. There's no silver bullet. There's no one way of treating this. And then when it becomes chronic, it's even more complicated. And it's crazy making. And it's the next thing that I'm going to really, I feel very, very, very drawn for many reasons. I feel very drawn to my next big project is going to be about this insidious world of Lyme disease. And I want this book to be written for not necessarily these coastal elites, but the reader in Wichita, Kansas, who's never heard about Lyme disease and can pick it up, and I'll have my story kind of interwoven throughout. But I'm looking for these kind of different case studies from different folks around the country, different socioeconomic backgrounds, different racial and ethnic backgrounds, different genders, children who've been impacted by this, of course, families, the financial piece, the insurance piece, all of these things, and how they've all colluded,
Sure.
and the rise in this illness and the rise in these diagnoses, and what does the future look like? But yeah, I don't want this to be just like a book that only people that have Lyme disease will necessarily read. I hope they do, and I hope they relate to it. But I really truly want it to be something that anyone could pick up, who had, maybe encountered even a degree of chronic illness, or a friend that had experienced something like this, and want to learn more and understand this world.
I think it's a beautiful track that you're on. I can't wait to read it. I started out doing retreats called Losing Lyme, and it was for that exact reason because we have a lake house in the middle of the country, and I would go back there and look around and think, how many people here are being affected by tick-borne illness. They don't even know. They're in wheelchairs. There was just a lot of sickness that I witnessed, and nobody really, getting to the root cause of all of that. And I think that, yes, the elites that can travel from New York to LA, to some of the major cities to get some treatments, are lucky. And we need to service the everyday person out there, like I said, that's working 2 or 3 jobs and
Yes.
still not getting answers and trying to provide for their children and their family while they're trying to work when they can't work and they can't get disability. And that to me is also criminal. So when you're writing your book, you're looking for these stories. How would somebody get in touch with you if they felt like they had a compelling story of the underserved or the story that maybe we don't hear every day about Lyme disease or tick-borne illness or chronic illness?
Yes. So I am going to just focus on tick-borne illness. I think if I go into chronic illness, it'll be like a 1,000-page book. So I
Yeah.
am going to just focus on tick-borne illness. It doesn't have to be Lyme. It can be something else. I'm looking for different case studies that if you were to kind of, plot them on a map, by the end of the story, you would not only have my version of the narrative and then all these different spinoffs in terms of insurance and out of network and diagnoses and the disbelief of chronic Lyme versus infectious disease camp, all these different sort of offshoots. But I'm really looking to tell it through the lens because I believe we hear stories and we remember stories and they resonate with us when they're true stories. And so I'm really looking for folks from different parts of the country, again, different ages, different genders, different socioeconomic backgrounds. It's very, very important to me to have compelling stories, but to also have them told from very, very different perspectives so that the reader comes away understanding that this is not something simply affecting this endemic, Northeast region,
Yeah.
or these hysterical women who are living in mold, and have now like taken that and turned it into all of these other diagnoses. I really want it to be truly a book that, but again, it has to, these case studies, I'm already starting to kind of do these like introductory interviews, and they also have to want to talk to me and share with me some of their deepest, darkest moments as well. And it's a privilege and an honor to get to do what I do. But it's almost like it's like I feel like I'm like speed dating on these phone calls because it's like, do they trust me? Do I trust them? And I can't have like I have these two different guys that have kind of similar stories. And I can't have both of them in it because it's like they're too similar. And so I'm like, I was just talking with a writer friend about sort of picking and choosing. I also really love interviewing people in person versus Zoom, and I have yet to sell this book, so I'm just in the proposal phase. So I would, of course, need to ask my publisher for some travel money to get to interview people in person if I can, whenever I can. I'm also hoping to interview some of the different physicians around the country that are treating this and the different ways that they treat it. Bee venom therapy, hyperthermia, plasmapheresis. I mean, we could just go on and on and on about all these different alternative treatments as well, which are fascinating to me too. So I'm casting a wide net. And if there's someone, that's had incredible success with never touching an antibiotic and has only stung themselves with bees, I would love to hear that story. Or someone that's, only traveled to Germany and done hyperthermia and that transformed their health, or didn't, now they're still searching for answers. I'm really just looking to represent kind of this vast cross section of folks that follow you and listen to you and connect with you.
Well, that's
So
so wonderful. I mean, I'm sure people will be interested in reaching out to you. Is there,
you could reach out to me through my website. There's a
okay.
contact page.
And what
Um,
is your website for?
Website is www.amanda, M as in Mary, Fairbanks, like Alaska.com. And there's a contact page and you can send me, the email just goes directly to me. I don't have an assistant. If I did, she'd be calling United Healthcare on my behalf.
I would encourage everybody to reach out and give her, if you think that this sounds appealing to you, reach out, and she'll I'm sure take some time in going through all of the requests and
Like a little health
that.
summary, give me like a
Yeah.
little bio, and then we'll set up some, 30 minutes or so to talk and kind of go from there. Is sort of what I'm doing right now.
Oh, well, Amanda, I can't thank you enough for your time here on Lyme
Oh,
Time. I'm really looking forward to your next book. I really want to help you promote it. And I hope you come back and give us even more of what you've learned about Lyme and insurance and helping those who are underserved. And I
absolutely.
just want to just take a second and say thank you to all of the hard work you're doing for all of the Lyme warriors out there who are fighting for their lives, who don't have answers, they don't have resources, and even to those who do, and are still stuck fighting with doctors and healthcare systems. So I just really applaud you, and I think this is a passion project. And you are going to change the lives of many. I just know you are.
Oh, thank you so much. And I'm so, I truly appreciate the work that you do and put out into the world. And I think it's about connecting with each other over the shared experience. And I think a lot of good can come from that. I really do.
Thank
But
you so much.
I think if we keep our stories, if we withhold them and we keep them in the dark, it's a lot of loneliness and isolation and suffering. And I think the more we talk about it and normalize this, the better, through the work that you do, through the work that I'm doing. So it's a pleasure, and thank you so much for having me.
Of course. We'll see you soon.
Okay, thank you. Bye. You take care.
You too. Thank you for listening to this episode of the Lyme Time podcast. If you like what you heard, please subscribe on your favorite platform to be notified of new episodes. Remember, this is not intended to be medical advice. Take your findings to your provider to see if something is right for you. No two bodies heal the same, and your doctor knows you and your labs best. You can find out more about the Tick Chicks at thetickchicks.com, and if you subscribe there, you'll be notified of upcoming events like the in-person Losing Lyme retreat that I host. I also have shopping pages dedicated to helping your at-home symptom relief, as well as a private support group. Join the Tick Chicks tribe on Instagram, YouTube, Meta, TikTok, Pinterest, and X. You are not alone.